have one right here. This is an intake. It's got a bunch of different information, health history, things like that. Now we have you do this because there are things that are illnesses or things that have happened in the past that we may need to know about before you get on the table. It just helps us know how to better help you. So like, for example, there's stuff on here like if you've had blood clots, or if you're a cancer survivor, fibromyalgia, or if you have migraine headaches, or things like that. That gives us a little way to ask questions to figure out where the problem is coming from and where we could best help you to treat those problems if they're treatable, or deal with the chronic pains that come with different and various illnesses. So like, for example, let's see, fibromyalgia. So I do have clients that do have fibromyalgia. Massage does work very well with that. Usually with that, I would ask them if they have neuropathy. Not all people that have fibromyalgia have neuropathy. So with that, I like to ask where their areas of most discomfort are, if they're in the middle of a flare-up. If so, usually with that, pressure-wise will change based on if they're in a flare-up or if they're not. Sometimes they're not always in pain in the same areas. So those are questions that we usually ask, and why, for the health history. Broken bones, we like to know that, so especially if we're going over something and something doesn't feel quite as normal as we would. We usually ask questions around that. And if you've already told us that I broke my bone some years ago, then we know kind of where that's coming from. We also know there may be scar tissue, or there may be muscles that may be more loose or tight, depending on what type break it was and where it happened and how it healed. All of that gives us information on how to better treat you. An important question on here is, have they had a professional massage before? That basically take you through what we're gonna do, so it's not just thrown at you and you kind of know what you're going in for. On the back of my intake, I have, which I'll show you up. It's just a couple of sentences that go over your rights. So as a client, you have rights. You have things you can and can't do, as well as therapists. They have things they can and can't do. If any of those rights are crossed, or at any time you don't feel comfortable, you're more than welcome to end the session, as well as a therapist. If the therapist is not comfortable, they are more than welcome to end the session. You have the right to complete privacy when you dress and undress. So the therapist should leave the room and enter back in after your dress are already on the table. You have the right to terminate the session at any time. I do put that on here, and I have my clients sign after, so they know and they're comfortable with saying whatever their wants and needs are for the session. Yeah, so that's what I go over on my intakes. A lot of people don't really read the intakes, and they don't know that they have rights. So I make sure that all my clients know that you're in control of the session. We can do or not do anything that you please.